This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about when you should get surgery for a meniscus tear. So this is a very common surgery in orthopedics, probably one of the most common, and they're done all the time on many different age groups. So if you're watching this video, maybe you have a meniscus tear or you have knee pain and you're wondering if you should get surgery or not. So first off, what are the menisci? They are these kind of rubbery shaped shock absorbers that you have in your knees. You have two on each side. One is O-shaped and one is more C-shaped. And they act as shock absorbers between your thigh bone and your shin bone. And what can happen is that sometimes through usually a twisting motion, they can sometimes get tears in them. And these tears can happen all different sorts of ways. Some are like this, and horizontal, vertical. And they can cause varying degrees of pain. So when someone gets a meniscus tear, it's usually painful, but not always painful, and that depends on the age group. If the tear is still propagating, meaning that it's continuing to get larger, we call that an unstable tear, and those are usually more painful, and those usually bring people to surgery. And what the surgery does is most of the time, the tear is just kind of cut away, so you're not really repairing anything. That being said, there's a couple different variants where if you get a tear all the way near the edge of the meniscus, then it can be repaired. And the reason why it can be repaired is the blood supply is good. Towards the other side, the side closer to the inside of the knee, that side part doesn't really heal that well. And people tried putting sutures in it and it just doesn't heal, and that's why it gets trimmed away. I had that actually done on my own knee when I was a teenager. So another reason to repair it is sometimes you'll get a meniscal root tear, meaning that the meniscus is anchored on each side, and if one of those anchors kind of pulls out, then the thing will be floating around, and that's something you want to get repaired. But by far and away, most meniscus surgeries are just trimming the torn part. So I would say that if your knee hurts and you've tried physical therapy and everything else, and you're on the younger side, and you've got a meniscal tear, you'll probably get some good relief from that surgery where they go and trim it out. Usually doesn't take you out for that long. If you do get a repair, they'll be a period, usually about 6 weeks at least, when you're not walking on it, and then a longer period of physical therapy afterwards. The question is, what happens if you're a little older? Let's say you're in your late 40s, 50s, 60s, and they discover a meniscal tear on MRI. Now, a lot of people have degenerative tears of the meniscus. It's usually in the posterior horn of the medial meniscus. So if you have an MRI of your knee and you look at it, that's probably what you'll see. And the question is, do people get better from that? And the docs are kind of split on this. Some people trim those all the time. Some people don't trim them. So that's kind of more up to you. I would say if your knee is not hurting too bad, if it were me, I'd probably put it off. So that's kind of more on the line of whether you should do it or not. But you can certainly seek a second opinion if your knee pain is getting better and the doctor wants to do surgery on you. I'm not a big proponent of doing surgery for people that don't have a lot of pain or their pain is improving. The third thing is if you're even older than that or you've got terrible knee arthritis. If you've got terrible knee arthritis, a meniscal tear surgery is not really going to help you that much. It's mostly the arthritis in the rest of your knee. So at that point, you're probably better served with steroid injections for a while or getting a knee replacement. So people tend not to scope older arthritic knees as much, although it is done sometimes. So I hope I was able to answer your questions about when you should get a surgery for a torn meniscus. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. If you like this video, we put out new content every Friday, so please like and subscribe. And thanks for watching.